Okay, so I hope you went and got something to eat because we are back with our Grey's Anatomy Season 1, Episode 2 case study. Now, there's a first part, so if you didn't see the first part, this second part is not going to help you. Remember, the first part talked about the issue of recognizing cues, analyzing cues. These two work together. First, you had to recognize them, then you had to analyze them. You remember how we said part of recognizing cues is pulling out all the numbers in the case study, the age, the time frames, the, anything about labs, any kind of numbers that would be meaningful. And so we have here a number that is meaningful. She's 25. We said that that was recognizing a cue. Age is a cue. And we said that in particular, her age is like childbearing age. So the whole I got raped, I could be pregnant thing is playing a role in our minds. It may not be a priority right now, of course, but it should play a role in how we approach the patient. Okay, so we had a bunch of numbers in this first one, the first video that we did on this case study. We had a Glasgow scale, so we went over that. Hers is 6, clearly she's in a coma. We went over blood pressure and the fact that it's very low, the relationship of blood pressure to shock. And so hopefully you got your lunch or breakfast or whatever, and you are ready to rock with the next two parts of the clinical judgment measurement. Clinical judgment, remember, recognize cues, analyze cues, prioritize hypothesis, generate solutions. These are the two that we are working on right now. So if you look at our case study, basically knowing that this woman has been a victim of sexual assault and trauma, you know that she's going to have some traumatic injuries. I always tell my students that whenever you think of trauma, think of quite a few things, right? Start with your airway and think pneumothorax. Well, guess what? Unequal breath sounds, yeah, pneumothorax. Think of any kind of bleeding because trauma is traumatic enough to cause bleeding. And guess what? She's got a sign of that too. She has a perforation, we find out in surgery. And so that is a reason why she could bleed. And how would you know if she was bleeding? Well, she'd have a brick hard or rock hard or board like abdomen. Okay, so we're on our shit, right? We know our stuff. So we keep thinking about prioritizing hypothesis. Let's look at some more things that she's doing. She's got a unilateral pupil dilation. She has blunt head trauma. We said that was a closed head injury any day in my book, and that patient was at risk for high ICP. In fact, we said that a unilateral pupil dilation was significant for concussion. So she probably took some serious blows to the head. Y'all feeling me on this? I hope you're feeling me on this. Okay, so we're going to look at some other things here when we're thinking about prioritizing our hypothesis. We've got 3 big ones, and I think you would agree that the fact that she has unequal breath sounds, she's got a possible pneumothorax, she has her state in and of itself is unconscious, so she's in a coma, so that's huge. We have our unilateral pupil dilation with the whole issue of ICP and brain tissue damage, right? So brain injury, traumatic brain injury. And then, of course, we have the possibility of bleeding. And frankly, depending on which one of those is going on, I think you know your stuff well enough to know that if it happens, and I always tell you this, if it happens between my sternum and my head, it's a priority. And we know it's a priority because if her lungs are if you hear unequal breath sounds in her lungs, then you know that she's going to have a problem breathing, and you know that already because she's unconscious. So the nurse, right? The nurse is generating solutions. She's trying to make sure that she makes choices in the care of this patient that will be an advantage or a benefit to the patient versus choices that are contraindicated with this patient. Included in generating solutions are, and it may not apply to this patient because of her state, but included in generating solutions, because I do think that's the one that's the foggiest for most instructors and students. Included in that is a pain scale. Included in that is making sure that the patient doesn't get worse, making sure that you prepare for what you believe is going on. Generating solutions also means that you're looking at what kind of non-pharmacological therapies and treatments and interventions you can make right away, right? It also looks at minimizing or reducing the injury. So this would be an example of if you had a broken limb, you would elevate it, you would ice it, you know, that sort of thing. Generating solutions is also your S-bar. How are you going to formulate your mind around the fact that you've got to give a report on this patient? And so already when we're doing our S-bar, which is situation, background, assessment, and request, when we're doing that S-bar, we already have to know what is going on with the patient. And don't forget that I taught you guys that with S-bar and with this whole thing called nursing, you pretty much got to know what the doctor knows and you got to know what the nurse knows. And you probably had 1, 2, 3, maybe 4 years of education, but the doctor has 12. So, you know, it's a hard job. It's a hard career path, but we're built to take it. So we're going to handle the business. So if we look at this patient, we've already prioritized our hypothesis. We know we've got to address her airway. We also know that we have to address bleeding because her blood pressure sucks. We also know that the brain injury is a priority. Trauma is hard because you may have 3 big priorities in a row. And it's like, well, which one do you handle first? Well, of course, airway. Typically, not always, airway typically is going to take precedent. So for this patient, the nurse has already prepared for intubation, chest tube insertion. She knows she's going to be on a ventilator because she's already unconscious. When it comes to the whole blood pressure possibility of hypovolemic shock that we talked about in the first video, and the fact that we have a reason why she might be internally bleeding, because that's what all traumatic patients half the time do, we know that we're going to be ready to start that IV. And what kind of IV are we going to do, y'all? That's why the age was so important. She's 25. You better be inserting an 18 gauge angiocath in this woman. And in this case, it's trauma. So you need 2 large bore IVs. So we have an 18 gauge IV. And how are you going to insert that IV? Oh, you're going to put that in a 15-degree angle. Be careful not to say 90. Be careful not to say 45. Oh no, boo. 15-degree angle, sort of like an airplane landing. That's what you're doing with this patient. 18 gauge at a 15-degree angle. What kind of fluids are you hanging for this patient? Oh, you better have said some isotonic solutions. What are isotonic solutions? Lactated ringers or normal saline. Either way, she needs a bolus because look at that blood pressure. It's 80/60. That's shock. And what do we know controls blood pressure? Volume of fluid. What volume of fluid has been impacted? Probably bleeding. So come on, y'all. We got this shit. We got it. All right. Now, so chest tubes. We prepared the intubation tray is at the bedside. We made sure the crash cart is available because she could crash any minute now. We've got our LR up, our IV started. We've got our type and screen and our labs ran because you and I are so doggone smart. We know if this lady's bleeding, she's going to need some units of blood. So we sent a type and cross, CBC, BMP. We got this. Oh, did you forget? I'm looking at you. I know you forgot. I could see it in your eyes. You forgot. Yeah, you did. And so what was the third thing that we said? We said airway. We said bleeding. Oh, the brain. The brain is injured, y'all. So we have to do our neural assessments like every 15 minutes until she goes to the OR. We're doing our PERLA. We're doing everything we can do. And we notice that we have a unilateral pupil dilation. So we already know we have a concussion. And so we're preparing her for brain surgery. Y'all feeling me on this? Because we just did prioritize hypothesis and generate solutions. And it did not take us all day. Now let's just make sure you prioritize, because don't forget, she does have some other issues. Yeah, there's the rape, there's the possibility of STDs, there's the fact that the sexual assault nurse needs to go ahead and get that DNA in those cultures and everything that we do. There's the fact that she's childbearing age, she could be pregnant, so we ran a pregnancy test. But I am talking about those things that are gonna save her life. Y'all feel me on this? Oh, okay. Well, I'll be back because you are not done. You've got 2 more out of the 6 clinical judgment parts to do. You've got take action, evaluate outcomes. See ya. Deuces.